All right, before we begin, if you haven't already heard, on behalf of our Lorraine City Schools family, it's with deep sadness that we share the loss of two Lorraine children in a car accident late last night. And I'd like now to take a moment of silence to pray for all involved and their families. Thank you. If your child is struggling as a result of this tragedy, please know that we have grief counseling that started today. It'll be available tomorrow and as long as it's needed. To connect with that, please call us at 440-830-4082 or visit us on our website for the information to get you to the right place. Okay, for tonight, the purpose is to get you caught up on where we are and what we're doing and why we're here. And I just want to give you just a very brief summary of how we got to this point. We got here because we listened to you and we engaged you, and we're trying to make sure that we're providing the supports that you need. We started asking questions over the summer, and our families made it very clear they were not comfortable sending their children to school because they didn't think we can keep them safe during a pandemic. We asked our staff and they said, no, we're not ready. And as we looked deeper, we weren't. I mean, we were not in a position to keep anybody safe, our staff or our students. So we dove right into remote learning, and we got devices to people and internet to people, and the training to our staff that they needed. And the training came from other staff. So it was a beautiful thing to watch, people leaning on each other and taking care of one another, which is, I think, very timely as we go through a pandemic. But while we were getting good at the remote learning piece, obviously our goal was to create mitigation strategies that would allow children and staff to return to our buildings in a way that is safe. And what we've said all along is, there's nothing is safe because there's a pandemic, but on a scale of 1 to 10, with 10 being the safest way to do things, everything we do will be at a 10. And I think the way Dave phrased it, Dave Colville in our last meeting was, the gold standard is X, and whatever the gold standard is where we'll be. Again, so we make sure that we're doing things that are doubled and tripled up in terms of making sure that there are layers and distances, and people are washing their hands and masking up. And so we are now to a place where we're safe, and we can provide a safe environment for people to come in and stay away from the pandemic piece. And the questions that I get a lot, well, one of the questions is, well, why is it when other school districts are backing off and actually taking more remote time that we're talking about going back or in person? And most of the districts that have been doing in person did take a break as they took a deep breath, and they're all most are planning on coming back after the holiday break, which is when we're planning on coming back. But for us, if it's not, I can't speak for other districts, but if when that time comes, it is not safe, and we've got a slew of medical professionals and public health officials and professionals and experts on this call with us, and we meet with them on a regular basis. And if it's determined not to be safe, we won't come to school. And I liken it to a snow day where people say, okay, Jeff, when are you calling a snow day? Well, we'll call a snow day when I don't think it's safe for kids to come to school. They say, okay, what's that look like? Well, it looks like a variety of different things. But we huddle up at 4 o'clock and 5 o'clock in the morning and listening to the experts about weather, and talking to the city people about how we're doing on plowing streets, and talking to our internal people about how we're doing at keeping our parking lots clear. So we're very inclusive. We listen to the people that have the information that we need, then I make a decision. But I am in no more better position now to delay the start of school because of the pandemic than I am to call a snow day 3 weeks in advance. So based on what we believe we know today, we can open up school on a scale of 1 to 10 at that 10. If when we get closer to that date, it becomes obvious that we cannot. One of the beautiful things about our plan is we need very little time a day to flip a switch, and the next day we're full remote. And if COVID disappears for whatever reason, the next day we flip a switch and everybody's back in. So the plan was put together with with some parameters that you'll see that allow some luxuries for children and families to change their mind about whether or not they want to be in person or remote. And again, the next day we can flip that switch and accommodate the family's request or that child's request. So, excuse me, what was going to happen today, I'm going to let Ross and Aaron take over here in a couple seconds and facilitate the meeting and walk us through our phase 2 plan. But before so, I want them to, if they could, introduce our guests. And again, we are so blessed to have, and I ended the last meeting with this, they choose consistently to spend time with us, and they don't get paid extra for it. They're not consultants getting extra. They go above and beyond to make sure we have what we need and that we can take care of you the way that we'd like to. And we have an exclusive audience with them every Wednesday morning, and it's all about us. We talk about whatever we want to talk about. And it's getting to the point now where they're also engaging more with one another. But the purpose of the meeting is to meet the needs of our staff and our children and our families to get what they need during these crazy times. And I just can't thank them enough for always making themselves available. And again, these are frontline people that are as busy as anybody right now, but they consistently make time for us. So I just want to say I would thank them for their expertise. They are great people, experts in their field, and we're just very, very blessed to have them as part of our family. So Ross, if you could maybe introduce our fans, and I did it again with Amerily this time, didn't I? I didn't guide folks to do the translations.
Yep. So I'm going to stop sharing real quick and back out to Zoom. And Amerily, I'm going to actually ask if you could, let me take you off the audio channel for a minute. And all right. So Amerily, do you mind actually in Spanish, just directing our listeners to the interpretation globe so they can get the audio channel in Spanish. And then after we do that, we'll turn you back on and they can listen to you in Spanish.
Okay. So right now I don't see the interpretation globe on my screen.
So it should be there. So it should be at that bottom bar. So you actually are not going to see it because you are doing the.
Okay.
I don't see it either, just so we know.
Okay.
Yep.
Okay. Buenas noches a todos que están aquí con nosotros. Si están participando y necesitan de la ayuda en español, si miran en el panel de abajo van a ver un globo donde dice interpretación. Pueden ir a donde dice español y ahí pueden darle para que así puedan escuchar la presentación en español. Okay.
Perfect. All right. Thanks so much, Amerily. So I'm going to reactivate this then. Hang on 1 second. All right, I think we got the little notification. I think we're good. All right, so just to then pick up with introductions. So again, like Jeff said, we are so fortunate that we've got Shar Ray every Wednesday and now tonight, and Dave Koval again Wednesdays and tonight, and then Dr. Prakash Ganesh from Case Western again during the day, Wednesdays, and then tonight to join us. Shar, do you mind just doing an introduction of yourself and for the group?
Sure. My name is Shar Ray. I work at Mercy Health, and I am a nurse and a mom, and I have been just so pleased and honored to partner with Lorain City Schools to make sure that they've got just the best program possible to keep everybody safe. So it's my pleasure, it's our health system's pleasure to do whatever needs to be done to keep the students and the teams, the faculty safe and COVID free.
Yeah, thanks, Shar. And Shar was extremely helpful as we were initially trying to figure out how to make this all work. She put us in touch with folks from Oberlin College who helped. We learned a lot from them, and some folks from the Ohio State Wexner Hospital to learn from them, and the ministry through Mercy Health to learn from them. So it really just helped kind of get us pointed off and in the right direction here with some of our mitigation practices. Dave, you want to go next?
Sure. I'm Dave Koval. I'm the Health Commissioner for Lorain County Public Health. We've been investigating illness around COVID since the beginning of the year, and so many of you may have Actually, if you were a case or a quarantine, one of my nurses may have contacted you to find out how you're doing and, you know, track your illness and try to help you get back on your feet. And so that's one of the main parts of the puzzle that we provide. The other one is to advise school districts and businesses and a variety of other folks in the community on how to open safely and how to operate safely. And so we've been partnering here with Lorain City Schools during the fall here as we've discussed how to come back safely and worked with the school district to really look at the plan and how to bring kids back safely.
And Dave's been holding our hand every step of the way. He's been giving us just very, very objective, just real time. This is what reality looks like. Here are your options. Here's the best practice. Here's some things to consider, maybe what some other districts are doing. And then most recently has helped us really kind of nail down our contact tracing process in partnership with his department. Let's see. I'm not sure. Prakash, are you available? Are you tending to children?
Kind of both. My name is Prakash Ganesh. I'm a physician and assistant professor at the Case Western School of Medicine in the Department of Family Medicine. I'm also a clinical consultant with the Cuyahoga County Board of Health. And I'm happy to be joining this team and being a part of it to help keep your guys' schools safe.
Yeah, thanks, Prakash.
If I could jump on real quick too, and I just want to share how this partnership kind of came together. And I think some people think that there's some things behind the scenes, or they came together because we reached out to Dave Koval and actually it was Ed Oley at Mercy Health. And we said, we don't know what we need, but we want some data to help us make decisions to find out if what we're doing is really keeping people safe and what's going on in our community, in our school community. And again, Mercy Health brought a bunch of healthcare professionals, and Shar has been with us every step of the way and outstanding. But we sat down and agreed that here's what we need to do and come up with, do a testing model that assesses the quality of our mitigation strategies to make sure that if anybody comes to school with COVID, no one else will catch it. And we're testing to make sure that holds true. And coincidentally, Ross bumped into somebody at Case Western Reserve and said Prakash is looking for a school district to look at their numbers. He's provided expertise. There's nothing study-wise can be done without people signing off and allowing it. And there were some plans originally that they were going to do some of their own testing, again, if people agreed to it and signed off on it, because they wanted to assess the degree to which COVID traveled, or the coronavirus traveled in a way that was similar to, and I won't speak to this much in depth, Prakash, because I'll screw it up, but similar to the common cold or the flu or whatever else. So that's when we started talking about the 19 different strands of things we're going to look for. And for whatever reason, that didn't work out. So he is just here providing expertise. And if that is going to be shared, either it will be done anonymously with we just yes, no stuff, very similar to what we're posting on our website, or people have to sign off saying, please use my data, or you're allowed to use my data. But again, but the partnership as it's grown has been amazing to watch. And as I shared in my opening comments, it started out being, again, holding our hands, looking over our shoulder, making sure every step we took was putting us at a 10 out of 10 on that safetyometer. And it's grown into something a lot more. So we sit down and problem solve a lot of different things. And again, I've been a superintendent now for about 20 years, and these things just don't happen very often where you have this level of expertise and everybody's willing to drop everything they're doing to be there to make sure we're in good hands. So again, I just thank you.
Mm-hmm. All right, so with that then, let's get into it. All right, so where we are in our Open with Care plan, we are ready to get into phase 2. We started obviously, and we've talked about this. You've lived this in a remote environment, as Dr. Graham said. When we asked you in the summer, you told us you were not comfortable that we could keep you or your children safe, and that if we did open school and you sent your child back, as soon as we had a case, and actually you told us in the district, not even just in the class or the school, that you were going to be pulling your kid back home. So when we looked and learned more, we realized we were not ready to open in person. So obviously we started in a remote environment, and we've been working to develop our mitigation practices, develop our staff skills through remote learning throughout the course of the first half of the year. And now we're ready to go into phase 2, which is family choice. On the remote learning side of the screen, again, you guys have lived this, you know it well. Some of the adjustments that we need to make right away, we recognize that all of our students and staff needed technology, so actual devices, internet through either partnership with Spectrum or with the hotspots. We recognize we need to make some adjustments with meal distribution here in the fall, and so we adjusted from 9 locations to 33 locations, and then also offered evening times as well. And then we need to check in with you. So when we checked in with you again in October and asked, how are things going? What's going well? What isn't going well? What adjustments do we need to make? And then we also got your input about, again, coming back to in person. So we so appreciate the information that you as community members, family members have provided all along the way here. So as we transition into hybrid learning on the right, we're going to go through and we'll talk through in some detail now what that actually looks like. What's the schedule look like? What's remote learning going to actually look like? What do the mitigation practices look like to help answer those questions? So remote learning, just simply, and I'll set this up and then we'll bring Barb Bowen in to talk in greater depth about it here. Or I'm sorry, the remote learning, you know what that looks like. We're going to go on to the next one, hybrid learning. What this looks like is that students are being divided into 2 groups, first and foremost, that have selected to come back in person. We've divided into 2 groups because when we looked at our classrooms and keeping students and our staff 6 feet apart, we recognized that we could not bring all of our students back at the same time. So to honor that space, and we'll talk about that 6 feet is an important mitigation practice for us across the district, we need to divide our students into 2 groups. So either later tonight or tomorrow, if your school hasn't told you already, you'll find out if you're in the A group or the B group if you selected to return in person. Wednesdays are going to be an asynchronous learning day for everybody. We will not have any students on site on Wednesdays. On the days that you're in person, you will be in person for those 2 days, learning in the classroom with the teacher, and those who are at home that day will be Zooming in and learning from that teacher at the same time. When it's your day to be remote learning, the other group of students will be in person. You'll be home, Zooming in from the teacher with your classmates again at that time. We're providing breakfast. So when students get here, they'll have breakfast. We're going to provide a snack, and then lunch will be provided on the way out the door with a snack for the afternoon as well. And then we're going to continue our meal distribution in the community, again, at those 33 stops, and then again with the evening hours. So let's talk just a little bit more about what the remote and in-person instruction is going to look like. And we've been calling this our live stream instruction model. Barb, you want to talk through this a little bit?
Sure. So we know how important it is that students are able to communicate and contribute to each other's conversations and learn from each other. And so what we've done is we've made it so that whether students are at home or whether students are within the classroom, the teacher will be able to utilize the smartboard so that students will be able to see each other. Teachers are aware that it's going to look a little bit different, so that because of the fact that we've now taught remote completely and we've taught in person completely, but now we're joining those 2 together. So some different strategies are going to be used, but now the students will be able to see each other. They'll be able to communicate together, and teaching will move forward with the students in person, and that personal conversations, but the conversations will be allowed to occur between the home and the school. So it's going to be a pretty cool situation, very unique. This is uncharted territory.
Yeah, thanks, Barb. All right, so let's talk about the timeline that we have left here. So we right now notifications should be again going out tonight and tomorrow if you haven't found out already through your child's teacher about which group that you're in, the A group or the B group, to return to school. We've actually been working on staff assignments all throughout our process, and so Our staff assignments are actually in place. So then the week of winter break, or after winter break, the week of January 4th, all of our staff return to the buildings, and we're going to transition to our new schedule. Now, students are still going to be learning remotely that week. They're not coming into the school yet, but the week of January 4th, then we're going to switch to our new schedule, which is going to be 4 days of synchronous learning again, and then Wednesdays will be an asynchronous day. We'll talk about that schedule coming up here more in a minute. Then the following week, the week of January 11th, that's the week then that students will come back. So we'll have all of our staff back that first week after winter break. Second week back, our students will be back and in the building and ready to go with the 2 days in person, 3 days remote for that week.
Hey, Ross. Also, for our high school students, when they return, can you explain a little bit about that schedule?
Yeah, and you know what, actually,
But just to reiterate, yeah.
Yeah, Aretha, do you mind talking just a bit about how the testing works for the high school? Because
Yes, absolutely. So
follow.
typically when students have their end of course exams or testing for their state testing within a regular year, they go on an adjusted schedule. And so we're basically doing that right now. So the first 2 weeks of the school, the state extended the time so that we can test up until January 15th. So we'll be assessing hopefully a couple hundred kids during that time with social distancing and mask and all the things that we need to make sure that kids stay safe. We'll be doing our testing for the first 2 weeks, and then the high school students will begin their regular hybrid schedule. I think it's January 19th. I'm sorry, I don't, yeah. Is it?
Yep, you're right.
January 19th.
Yeah, thanks, Aretha.
You're welcome.
And we have to give those tests in person. There's no wiggle room on that. That's a legislated item. And so that's just our reality. So as we look at phase 2, the guiding principles that we used to put our plan together were these 4. So as much as possible, we wanted to keep our students with their current teachers. We did not want to be in a situation where students and families had to make new relationships with teachers at the halfway point of the year. So that was our first principle, that we want to keep everybody together. The second one is that we want to make sure we can provide flexibility. We know that we're going to have students that need to learn from home for a time, whether they're quarantined or maybe they started out you start out remote and you decide that you're ready to come back in person. We also know that we're going to have some teachers that need to be able to teach from home at a time. Perhaps they need to quarantine. So our second guiding principle here was flexibility. Then, as much as possible, we want to maintain our secondary schedules. We do not want to be in a position where we need to add or drop classes. If a student signed up to take a class in the second semester, they need to be able to take that class. And then lastly, we want to be able to keep our families together. When we looked at assigning our A groups and our B groups, we looked across and by household, assign students into groups. So you should be sending your children to school on the same days. If they're in different schools, that shouldn't matter. By family, you should be attending the schools on the same day. So those were the 4 main principles that we used to go forward then to design our instructional model. Bill, do you mind talking through just again to help people understand the A day, the B day, and the full remote and what that means for being in school and out of school?
Sure. So I'll give a scenario that explains A groups and B groups. And we look at it from a perspective of a 5th grade classroom where there are 24 students on the roster. And let's say that 12 students or families choose face-to-face instruction. So we would split the 12 students into 2 different cohorts. 6 students would show to school for face-to-face instruction on Monday and Tuesday, and we're naming that the A group. And the other 6 students who choose face-to-face instruction would come to school on Thursday and Friday, and that represents the B group. So from a classroom perspective, there would be 6 students in the classroom, and 18 students would be live streaming in right alongside those that are learning face-to-face.
Okay. All right. Thanks, Bill. So we've got a calendar here for if you're in the A group, the days in red are the days that you would be in person. Any of the Wednesdays that are marked in that dark blue are asynchronous days. And then the days in gray would be the days that you're learning remotely. Any day that you see in that yellow color, it's a day off of school. If you're in the B group, same idea, just colors flip for you. And again, you'll be getting this information if you haven't received it already, either later tonight or tomorrow. From a contact us standpoint, at any point, if you've got questions, please reach out. So we've got the school numbers here, extracurriculars, if you need to talk about athletics or transportation, health clinic, preschool, you just need help with technology, anything, please call us so we can get right back to you as soon as possible to help with whatever you need. Is Marianne? I think I saw Marianne before.
I am.
Perfect. All right. So Mary, I want to invite you to conversation now. If you can talk about how we've been working to get our schools set up to make sure that we've got just safe, clean learning environments and what your team has been working on.
Sure, absolutely. From a building readiness level, we have been working on, first of all, making sure that all of our classrooms are set with a 6-foot social distancing. All the desks are set that way. The HVA system, filtration systems throughout the district and all of the buildings, we've increased the filtration up to a MERV rating, which is something that comes through ASHRAE, the American Society Heating, Refrigeration, Air Conditioning Engineers. Their recommendations, we have a pre-filter and then the recommended filter that they are, their guidelines are saying, and then a post filter. Our systems will be running 24/7 to continually move that air. With the water in the buildings, the fountains will be turned off. However, we have bottle fill stations in each of the elementaries have 2, middle schools have 2, and the high schools will have 7 installed in different locations. The personal protective equipment, we have assorted sizes, youth, small, medium, and large, face masks, as well as adult sizes. Gloves will be available as needed. Hand sanitizer and disinfectant wipes will be in the classrooms. There are hand sanitizing stations also throughout the buildings. Our cleaning staff will be on the afternoon shift to do a thorough cleaning throughout the evenings when staff and students are no longer in the building. We have misting machines that will lay a coating, a disinfectant layer on any of the surfaces that it is sprayed on. Custodians will be available during the day to make sure that they are periodically checking restrooms and sanitizing those areas as well. I think we are following all CDC guidelines as well as the general readiness assessment that we follow. And let's see, I think that's pretty much it.
All right, very good. All right, yeah, thanks, Mary. So the next bit here, and want to invite Dave and Shar and Prakash to the discussion here. Just what happens if folks are, not if, but we will have people that test positive. So what happens? So at a simple level, if you're sick, you're not feeling well, please stay home. We don't want you to power through or come in, and please stay home. If you test positive, you will be put in isolation, which is for at least the 10 days. And if that happens, you can still learn from home if you're feeling up to it. Again, our model is designed to be flexible. So you're learning remotely that day instead of coming in person if that was a day for you to come in person. If you're determined to be a close contact with someone that tested positive for COVID, again, you need to quarantine. This time to be for 14 days instead of isolation for 10 days. But while you're in quarantine, please continue to learn. So please continue to join the instruction just remotely. And again, when that day is 14th day is up and you're symptom free and you're feeling good, please come back to school and join us back in person on those in-person days. Dave, Prakash, Shar, I just want to invite you guys in here. Anything you can just kind of talk a little bit more about the importance of checking symptoms, the difference between the isolation and the quarantine, anything related to those items, and how to know when to come back?
Sure, I'll start. It's important to remember when you come down with COVID that you want to go a full 10 days and be asymptomatic when you come back. And the reason why that is you may feel fine after a day or two, but you need 10 days for your body to no longer be able to give that virus to someone else, to shed that virus to someone else. And so you need 10 days and 24 hours of being not symptomatic. Now, it may take longer than that because the disease can last longer. But again, as long as it's at least 10 days and you're 24 hours asymptomatic, then you can come back. Now, the difference is with quarantine is as if you were exposed to someone. And so if you're exposed to someone, it really has to do with what an incubation period for the virus is. In other words, how long does it take for the virus to get you sick? And so that's 14 days. And so really the key is to stay away from everyone else so that in case you do start to come down with it, you don't spread it. And so you may wonder, well, why is it 14 days? And I know the CDC has talked a little bit about lowering that to 10 days. And so for folks who are, essential workers like a nurse or someone like that needs to get back to work, we know that most of the time, if you're going to get sick, it'll be between day 5 and day 10 of you being exposed. And so mostly the last few days you could go back to work if you had a mask. But in a situation like this with schools, it doesn't really make sense to come back early. And so again, if you go that full 14 days, most people will not get sick. So that's a good thing, but that way you won't spread it to anybody else.
Yeah, thanks, Dave. Just a little bit on the contact tracing. So we have been partnering again with Dave and the health department on our contact tracing process. So we have a district team of 5 contact tracers, and then each school has actually the principal, assistant principal, and secretary are all contact tracers. We had some of the folks go through their training today, and the rest will go through tomorrow. But when we have positive results, positive COVID results, our team will conduct the contact tracing in partnership with Dave and his team at the health department, and we'll be notifying you if you're determined to be a close contact. We'll also be sending out a notification to the school informing of a positive case. If you get or are determined to be a close contact, you'll get a phone call, a text message, and a letter informing you. So we'll make sure that you know if your child has been deemed to be a close contact. If you don't get the phone call, the text message, or the specific letter, we're just letting you know that there was a case in the school, but that you're not a close contact. You do not need to quarantine. Just on this, we are again extremely fortunate to have a great partnership with Mercy Health, and so we have a clinic in Washington Elementary School. So if you're not feeling well, you need an appointment. One of the things that we learned in our October survey is that many folks don't know we have this clinic. So please take advantage of it. Katie Malier is our nurse practitioner, again, through Mercy Health. And she is happy to see you either through telemedicine, or if we need to do a COVID test, we'll do a drive-through. You'll be in and out very quickly. But please contact and use the clinic if you have any concerns that are health related that she can help with. And again, Dave, Prakash, Shar, do you guys mind talking just a little bit more about the importance of just like self-assessment and how to tell, are these COVID symptoms or are these just allergy symptoms? Because sometimes that can get confusing.
Yeah, I can do that. Sorry, my daughter is singing in the background. It can be very hard. We've seen a lot of cases now where people are worried about allergies and they think that their symptoms are allergies. And it can be very confusing with the current. It could be very confusing with the current weather changes. So what we want people to really do is make sure that they're taking those practices and the mitigation practices, wearing masks and staying away from the public and family gatherings, but also looking out for new symptoms that develop perhaps after some of these gatherings, things that are out of the ordinary for you. Even if you do develop symptoms of allergy, you really got to think in the back of your head, is this COVID? And then call your primary care doctor and see if you can get tested to make sure that it's not COVID. And then that way you're not spreading or bringing it home to the family.
All right, thanks.
Sorry about that too.
Yeah, no, and your daughter singing is awesome. Makes me nostalgic for my kids when they're that age. We've got a definitions page here, and Dave already touched on the difference between isolation and quarantine. Dave, you want to just go any deeper on that, or think we're pretty good on that from the prior discussion?
No, I think that's fine. The one thing to remember is if you live with someone who's a case, you're pretty much going to be quarantined. Okay, but the way that school is designed, if one child in a classroom is a case, probably there won't be any other exposures because again, we're 6 feet apart, we're wearing a mask, we're washing our hands. And so that's the reason that's so important to design the school the right way.
Yeah, thanks, Dave. So let's talk more about some of the specific just mitigation procedures that we have in place. So we are mandating that masks are mandatory. We've had a few requests for, can we maybe wear a face shield instead? And Prakash, depending on the song that's playing right now in your house, do you mind sharing just the metaphor that you've used with us a couple times now around how to think about viral spread in terms of how you metaphor it to smoke?
Sure. One of the main ways that we're concerned about the virus spreading is respiratory droplets. And face shields really, like if you think about it spreading like smoke, you can see the spread of smoke quite easily around a face mask, below a face shield. So we recommend wearing face masks. That's one of the better ways. It doesn't reduce your risk 100%, but it reduces it significantly from spreading those respiratory.
I think we.
Russ, and this page is really helpful because we get a lot of questions about, okay, so how are we keeping people safe? And like this is how we're keeping people safe. Amy Acton had introduced to me, at least, maybe to a lot of our viewers, about that Swiss cheese model, about the importance of having various barriers. So it's not just the face mask, but it's if another person is also wearing that face mask. Dave or Shar, can you speak more scientifically about that than my piecing it together with my hands?
Well, I'll say this, and it won't be that scientific. Everything's a barrier, right? So we want to reduce risk as best we can. So if I'm wearing a mask and you're wearing a mask and we're 6 feet apart, that's 3 barriers. If I take down my mask, then we only have 2. And if you take down yours, we only have 1. And if we get too close, we have 0. And so again, if we think about it, whether it's holes in Swiss cheese or whether it's just this idea of multiple barriers, that's why masking and keeping separate and washing your hands, those are all can be a barrier for the virus.
Yeah, thanks, Dave. So yeah, face masks are mandatory. We provide and professional development on our mitigation practices. We are going to collect seating charts any place, the classroom, cafeteria for those that use it for breakfast, buses, any place. We will have the seating chart so we know where students are supposed to be and then who would be the closest to them. Again, we're going with 6 feet. There's some districts and you can go a little bit less than that, but we're maintaining 6 feet of distancing. Again, hand hygiene. We've got the sanitizer all over the place. Mary talked about that earlier. So we'll be very frequently washing hands. And then, yeah, Aaron and Bill, do you guys want to talk just a little bit about the water bottles here?
Yeah, and also if Mary is still on the call, we've had a couple questions in the chat about bus safety, and in particular, like how do we maintain distancing on a bus, for instance?
Sure, we're currently working with First Student, who provides our transportation on seating charts and keeping distance with students. Of course, if they're from the same family, we can seat them together, but we will make sure that we have the distance, the social distancing in place on the buses as well. Again, with having regular sanitization of those vehicles. So that's where we are at this point in time.
Yeah, thanks, Mary.
Mhm.
And just on the water bottles, we are turning off and have turned off actually the water fountains, but we're encouraging water bottles. And so, yeah, Bill, Aaron, you guys mind talking about that a little bit?
Sure. Yeah, Aaron and I have been working together on the water bottle project, and our kiddos will have a water bottle on return, and they'll don our positive behavior plan, which is kind to self, kind to others, and kind to environment. So we're looking forward to providing those water bottles to our kiddos, and they'll be using those filling those in the hallways at our water filling stations.
Yeah, thanks, Bill. So then just a bit more here on our mitigation practices. I want to talk just a bit about testing, and Shar, I want to bring you into the conversation here, because Shar's been really instrumental in setting up and guiding us and helping us to set up our testing process. So the first bit is our testing process is completely voluntary. We're not mandating COVID tests for our students or our staff. Now, we encourage you to participate because the more people that participate, the more accurate our information about spread is going to be, about how accurate our mitigation practices are going to be. And when we find positive cases, we'll be able to keep people safe quicker and more accurately. So we will be doing random testing for COVID when we return from winter break. If you decide to opt in for your child, you have the same chance every single week of being selected. So it's not like we're not testing everybody, but we're going to test, again, a random sample of our students and staff each week. So if you are tested the first week, you may not be tested again, but you conceivably could be tested multiple times. You also could be tested no times. So that's kind of the random part of it. But Shar, do you mind talking just a little bit about the testing so far and with our athletes and how that's gone? And
Sure.
then Jeff Kruske, see you on too, and maybe we can bring your voice into the table here too, to talk about what we've learned so far.
So Katie, as many of you know, is just delightful, and she has been working closely with the school nurses and Jeff and his team already for many weeks, testing student athletes. So we're very much prepared for the students to come back. It's a very simple process. It really just takes just a few minutes, and it's a small nasal swab. It just swabs in the front of your nose area, back and forth a few times, and then that specimen is put back in the container and sent off for the lab to do its work. So there's a little bit of paperwork that has to be filled out, and then students will go through a process where they get the test, and then they can go back to back to their regular daily activity. So it's been a good and simple process, and I think everybody who's gone through it it's less worrisome than they thought it would be. People always think it's worse than it is, but it has not been bad.
Yeah, thanks, Shar.
I will second that. Our children had their COVID testing done by Katie, and they are like crazy drama queens. And they said that it itches. They said that it wasn't painful. It wasn't overwhelming. And they're like,
don't listen to anything that you've seen in the YouTube or whatever about the testing. It's very, very simple, and it doesn't hurt.
And I think the students would agree with that. We are running on average 75 to 100 athletes through every week. And once we get through, the paperwork actually is the longest part of the process. The swabbing takes seconds to go through. What I would recommend is when we start out initially is to have the paperwork completed up front if we could. That would help support the process to get us to move at a much quicker rate. And we also invite parents as part of this, if they have any questions about the testing process, they can also call our office or reach out to one of the practitioners to gain insight. But it is a very simple process. I've gone through it myself.
Yeah, thanks, Jeff, and thanks, Shar. So just a couple other things here. The wellness rooms, each school will have a wellness room. In many cases, it'll be a kind of a higher ceilinged area in the building, but it's a space where if a child develops symptoms, that they'll go and they'll stay there and then wait for a family member to come pick them up. Again, if you're sick, stay home. We love you, but keep your germs home. If you're just not even sure, and then as soon as you're feeling better and you're okay, come on back. So let's talk just a little bit about our expectations then, and how our procedures will start to work. So we've got a couple things here to really help provide, I think, consistent, clear, and succinct guidance. So we're framing our return to school expectations around kindness. And so we want to be kind to ourselves, kind to others, and kind to our environment. And so in a very similar manner as a traditional school year, when we come back to school at the beginning of the year, we spend a lot of time teaching, practicing, reinforcing expectations. And this is going to be no different. So when we return from winter break, your children will be taught our kindness expectations. They'll have a chance to practice them, have a chance to be reinforced for them, and reminded in an ongoing way. We also, you're going to hear this a lot. Dave has mentioned it a couple times tonight already. You're going to hear a lot about wash up, back up, and mask up. And if we can do these three things, we're going to be safe. So if we can practice really excellent hygiene, if we can stay 6 feet apart and we keep our masks on correctly up over our nose, covering our mouths, we're going to be okay. So we're going to have signs all over the schools. You're going to hear staff reminding students many times to wash up, to back up, and to mask up. So we will teach specific procedures around arrival, around dismissal. So how to arrive to school, what dismissal looks like. Oh, yeah, go ahead. I'm sorry.
Before we get too far ahead, there was a question in the chat about that student testing, where and when the students will be tested and who will be conducting the test. And I know we had talked about that first week back, that that would be an opportunity for them to get their baseline COVID test with their parent or guardian, with a family member, to kind of ease the concern and to, feel safe while they're getting their first one. But is Kursky still on the line to share some of that protocol?
Yep.
Sure. Testing will take place in the building. Each building has a specific number of students that they will be testing on a weekly basis. Again, going back to what Ross mentioned earlier, that will be done through a random process. The testing will take place and it will be tested by school-based nurses. So the nurse that supports the building will be the one that will be going through that. There are specific protocols to how the testing takes place to make sure that we're meeting all the CDC and health department guidelines. And it is something that we talked about, the baseline testing. To your point, Aaron, the goal, if we can get a baseline test, that helps us to then track and monitor students coming in and also to create the safest environment possible.
And just on a notification part of our process, for those that opt in, every student that opts in to participate in our testing will be assigned a number, and we're going to use a random number generator. And the week prior to when your child will be tested, you'd be notified if your child is picked to be tested. And so you'd get notification the week prior, and then when the testing would happen is, as Jeff Gruski said, it happened in the school with the school nurse. They'll go down, they'll get their test, and then again right back to school again, or right back to class again. So it won't be a surprise. You will know if your child's been picked, and then for what day that they'll be tested, and again a week ahead of time. So it's not going to be just where we're just grabbing kids and testing them and sending out. You'll know ahead of time when that testing is going to occur. And on our staff side, again, we're going to provide actually that same 1 week notice. So our staff will find out a week before when their test is, their COVID test is for the following week. So just back to then some of our procedures. We will teach and practice and reinforce what arrival looks like. If you've been past any of the schools, you see footprints outside that are distanced out, so students will know where to stand, just for example, at a really simple, obvious, visible level. But we'll practice arrival, we'll practice dismissal, eating procedures, class transitions, how we move about the building and stay safe. You may also have noticed yellow markings on the floors and the sides of the walls. What expectations look like during instruction. Also for those who are learning remotely. So we've got an in-person and a remote component for each of these procedures. Visitors and material pickup. Just real simply on this, for visitors, you're not going to be allowed to pass the office. So if you need to drop something off, maybe if your child forgets or you need to pick your child up early for some reason, you'll be allowed into the office, and we're only going to, depending on the size of the office and in the school, 1 to 3 people in at a time. So again, we can maintain that at 6 feet. But we'll have more information coming with very, very specifics, and I think video as well to show that. What transportation? Oh, yeah, go ahead, Aaron, I'm sorry.
Yep, and this is for our families and everybody watching from home. This is the nitty gritty that we are asked so often about. Exactly how students are expected to behave upon arrival and dismissal, all throughout the day. So this explains how they will be instructed and how to do those, how it's reinforced through the day, and as Ross is explaining, how we will share with families at home so they can be reinforced there too.
Mm-hmm. Yeah, and then our teachers will be instructing this again when we come back. They'll be introduced to it the week of January 4th, and then when for those that are in person, we'll actually do it. Again, they'll have a chance to be taught, practice it, reinforced, and again, there's an in-person and a remote component to each of our procedures. It's all framed through the lens of kindness. So again, being kind to yourself, what that looks like for arrival, being kind to others, what that looks like for arrival, being kind to your environment, what that looks like for arrival. And then again, you're going to hear a lot of wash up, back up, mask up. We do those things, we're going to be safe. A few more things about expectations. Most events will be held remotely. Maybe the school-based things that you've had in the past have been on site. Where we can, we'll hold those remotely. We've talked actually a number about of the adjustments we've made to the classroom expectations already, but we removed a lot of furniture, so extra furniture so we can get more students safely. Again, 6 feet apart. We're not going 3 feet or 4 feet, 6 feet apart in our classrooms. The other item, just on sharing supplies, students will have their own materials, so we're going to minimize the sharing of resources between students. We're not doing field trips. We talked just a little bit about visitors. Again, you won't be allowed past the office, and volunteers. We love volunteers, and we want to maintain those partnerships. We're just going to ask that they continue remotely for right now. Extracurriculars, that's going to be kind of a case-by-case basis. Some will be allowed to go forward, others won't, just depending on what the extracurricular activity requires. For meals, again, we are going to be providing breakfast in the morning. We'll provide a snack, and then lunch will be provided on the way out. So we will not be eating lunch in school, but lunch will be sent home. Many classrooms are going to be used for breakfast. Some of our schools, a combination of classrooms in the cafeteria or gymnasiums will be used. No sharing food, no trading. So what you get is what you get. And then we are again going to continue to provide our meal service throughout the community. So the 33 locations, the evening hours, that will all continue. For transportation, Mary talked about this earlier, but just to reiterate it again, we're providing busing, and we're working on that right now. Mary, if you're still on, we're looking not this coming week, probably the following week, for notifying families about their bus assignments and pickup times.
Yes, we are hoping to have notification out by the 28th.
All right, very good. Yeah, thanks, Mary. And Mary just mentioned this earlier, but just to reiterate, family members would be allowed to sit together in seats, but otherwise we're going to maintain 6 feet on the buses. Masks still need to be worn, and students need to stay in their assigned seats. Students with disabilities, Jane, you want to? Is Jane on now, or is she not with us? Taken by the silence, Jane's not with us. So just a couple things here for students with disabilities. The schedule for our students with disabilities, the return date, it's all the same. For staff that support students with disabilities, return date, schedule, all the same. The only difference is for our students with the most significant instructional needs. This past week, the intervention specialists have been calling our families of those students and inviting them to participate in person for 4 days. So if your intervention specialist or child's intervention specialist has called you and offered you the 4-day option, we encourage you to take advantage of it. But if you prefer to not and maintain the either 2 days or the full remote, again, that's completely your choice. We also have ordered and are providing our staff with additional personal protective equipment. So where we need help maybe with toileting, for example, or social skills to maintain distance, or maybe that's more difficult. We have additional face shields and gowns, gloves. So our staff has additional protective equipment that they need. Erin, you want to pick up communication from here?
Yeah, I feel obligated. You poor thing, you've been talking for, I feel like 3 months now on all these town halls. Yeah, so for everybody who's viewing from home and who's joining us on YouTube, Facebook, etc., watching this afterwards, you can always submit any additional questions that you have to us through Facebook, through email. You can give us a call anytime, and we will continue to compile those answers to frequently asked questions on our website. When you look at this presentation online, that first line that says view answers to FAQs, that is a clickable link that will take you directly to that information. If you go to our website, lorainschools.org, and I'm trying to remember to speak slowly so that Amerily is not going crazy trying to translate. At the very top bar is all the information about phase 2 so that you can look at this information later. In addition, we have tons of resources for you about COVID safety that we have stolen from Public Health Department, from Mercy, for you to be able to review. These links will take you directly to all the places that you can get information about your schools and to sign up for additional updates, whether it's an e-newsletter, whether it's social media, whether it's our texts, or more of these town hall meetings. We will try to get information to you in every way we can in English and Spanish. Thank you.
All right, and Dr. Graham, anything you want to finish up with here?
You're on mute.
Yep, just want to say thanks. I appreciate everybody spending some time with us, hanging out with us on a Thursday night. Again, I want to thank our guest panelists for not only tonight, but for all the times, and looking forward to whatever comes next. But Erin mentioned before about the helpline. I just want to encourage you to call that if there's anything you need. It doesn't have to be school related. We have connections. We can get you in touch with the right people. So if there's anything that you need, resources, supports, please let us know. And if I don't see you beforehand, have a great holiday. Thank you very much.